Hello, my name is Dr. Miranda Moore, and I am referring my patient, Ms. Barbara Baker, to you. We have pre-diagnosed the patient with acid reflux disease, also known as gastroesophageal reflux disease. And so a couple things that the patient has reported. She said that she experiences regurgitation after eating certain foods, and she also has halitosis, meaning she has bad breath. And a couple other things that we noticed was that we believe what has caused the acid reflux. So the reflux is where the fluids are moving up the GI tract and back through her stomach. Back through her stomach, into her esophagus, and then out through her mouth. And so we believe this was caused by a hiatal hernia, which is where the stomach is being pushed through the diaphragm when it should not be. And so we fear that if she does not treat this condition, then it will result in esophageal cancer, which would look like the patient having difficulty swallowing, and her problems with indigestion will worsen. And so we did an endoscopy to see what was going on with her esophagus, and we noticed that she does have esophagitis and Esophagomalacia. And so what that means is that there is her esophagus is thin, and it's also very soft. And this is affecting her digestion, obviously. And so with the endoscopy, we were able to visualize the interior of the organ and see what had resulted from this regurgitation process that was occurring. And so the esophagus, as you know, of course, as a doctor, is the food pipe between the pharynx and the stomach. And if you could just please reiterate this to Barbara, make sure that she knows what all is going on with that. And so what we recommend as treatment for Barbara is that we would like to provide her with antacids to reduce some of the regurgitation that she's going through, and to make sure that those acids aren't and the stomach fluids aren't coming back up for her. And we would also like to recommend a diet for her with less acid intake. So with a pH lower than 6 is not recommended, so she could limit those foods with that. And so if you have any other questions, feel free to message me. Just make sure that you take care of Barbara the best you can. Thank you so much.